Welcome. This is Integrative and Strength-Based Supervision. And what you're about to watch is a recording of a workshop that I presented in Portland, Oregon in April of 2020 to about 30 participants. That was live video. And throughout this workshop, there are lots of moments when we break out into discussion groups so that people can integrate some of the materials I presented and discuss questions or prepare questions that they bring back to me. And I would encourage you during those time chunks, we've cut those out of the recording, but during those moments, if you want to do some of your own thinking and reviewing of the material that you've been hearing and take some time to think about what is it that you want to particularly remember or integrate into your own practice of supervision, that would be great for you to take some notes and do some of your own thinking during that time, and also to use the time to review some of the numerous handouts. There are over a dozen handouts that I've provided as part of this package that you can look at and print and use as ongoing resources in your supervision practice. This workshop was directed at mostly social workers in the state of Oregon, but it's relevant to people who are supervising in other clinical professions, and the CEUs have been transferable, I know, in the past to people who are LPCs or LMFTs who are looking to get some of their hours for supervision qualification, but it's specifically tailored more to social workers and to the state of Oregon. There's one section where I talk about licensure requirements, and during that time period, I would encourage you, if you're from a different state, to get online and look at what the specific requirements are in your state in terms of numbers of hours that you need to provide supervision and other parameters. Just to tell you a little bit about what's ahead, this recording is divided into 3 segments, and in the first one, I'm going to be describing a rationale for why I focus on strength-based supervision and what I mean by that, and certain strategies and priorities in terms of building a good supervision alliance. And I'll be talking about intentional use of the relationship and how we can build a supervisory alliance that's positive and safe and contributes to self-reflection and learning on the part of the supervisee, and talking specifically about early supervisory sessions and what you can cover in terms of expectations and clarification of roles and goals in a collaborative way. I talk also just about balancing the different roles of supervision or of a supervisor, to be a supportive person and someone who enhances the reflective capacity of the supervisee, but also to be a teacher and to be a consultant and to be a monitor and a kind of a gatekeeper for our profession, and in that sense to provide evaluation and feedback. And so there's a lot of different roles that we have to step into, and balancing them can be tricky, and I discuss some of the challenges and strategies for addressing those. Later in the second segment of the second video, I'm going to be talking about consultation and case consultation and some of the different strategies we can use when we're consulting. And I do a role play demonstration of a case consultation, and it's a live actual consultation I'm doing with somebody, and discuss some of the strategies that I'm using in that. And then we shift into talking about dealing with common supervisory challenges, and in particular, some of the skills involved in supportive confrontation. And supportive confrontation is a really important skill for a supervisor to have, because we need to confront in an ongoing way some of the issues that are important to enhance the supervisee's effectiveness or address problematic issues. And if we don't have skills in doing that supportively, we hesitate to do it when we need to do it. And these difficult and challenging conversations can be very fruitful and contribute to the growth of the supervisee if we can have them in a way that's effective. And so I talk about strategies for supportive confrontation, and also just some ideas about evaluation and risk management. And in the final section, I talk more about integrating various models of like therapy models and approaches into our supervision practice. Talk about using narrative therapy and solution-focused therapy. I talk about person-centered therapy, and especially about skills in enhancing empathy and how we can specifically and intentionally enhance the empathy capacity of our supervisees. And I talk a little bit about trauma-informed approaches to supervision and some other models that we can integrate, because really we want to have a lot of tools in our toolbox and be able to respond to the moment and fit with what our supervisees are interested in and need, depending on their setting and their skill sets and what they're excited about. So that's a little bit about what's ahead, and I hope that you really enjoy this recording. And in the end, there's directions on how you can fill out a survey and do a post-test if you want to get the 6 CEUs that are part of this package. All right, enjoy.